Hi, I'm Dr. Elizabeth Klodas, cardiologist and founder of Step One Foods. And you know, throughout all of May, we've been talking about heart disease and women. And heart disease is our disease. It is the #1 reason why women die. Heart disease eclipses all forms of cancer combined as cause of death in women. And so therefore, we should be doing everything we can to prevent this because heart disease is preventable. Today, I wanted to talk to you about very unique risk factors that women bring to the table that don't even apply to men. We know high cholesterol, high blood pressure, diabetes, inactivity, and so forth. Those are common risk factors among both genders, and they're equally, impactful. But women have very special, unique risk factors that they should be aware of, and they may not even realize that something they experienced could put them at higher risk. So let's go through those right now. The first one is preeclampsia. Preeclampsia is a condition where in the second half of pregnancy, women develop high blood pressure and protein in their urine. This occurs in about 2 to 5% of pregnancies, and it can be a very serious condition necessitating early delivery of the baby. Preeclampsia, as it turns out, really escalates the woman's heart disease risk over her lifetime. Women who experience preeclampsia have a 2-fold increase in experiencing coronary artery disease, stroke, or death due to heart disease during their lifetimes, and they also experience a 4-fold increase in the risk of developing congestive heart failure. This is a big deal. Why women develop preeclampsia is not exactly known, but there are multiple risk factors that contribute to this. These include obesity, high blood pressure, diabetes, kidney disease, previous history of preeclampsia, lupus, age over 40, this being your first pregnancy, having multiple fetuses at the same time, having undergone IVF therapy, or having a family history of preeclampsia. Now, not all of those are linked together, but if you look at the ones I've now put in red, look at all of these: obesity, high blood pressure, diabetes, kidney disease, history of preeclampsia, lupus. These all are actually risk factors for coronary and vascular disease. So the same things that put a woman at risk for developing preeclampsia are also risk factors for developing heart disease. And that's probably the risk between the two conditions. If you have experienced preeclampsia during pregnancy, talk to your doctor about that. Make sure that you are on top of all of your risk factors because you are at increased risk of developing heart disease during your lifetime, irrespective of everything else. Okay, next, polycystic ovary syndrome. This affects about 5 million women in the US. It's a hormonal disorder that influences how our ovaries function. Women develop little cysts on the ovaries, which is why the condition is called polycystic ovaries. It's also associated with acne, menstrual irregularities, excess hair growth, but it affects a lot of women. And women with polycystic ovary syndromes have a much higher likelihood of having an abnormal coronary calcium score or an abnormal CIMT, which is a carotid intimal medial thickness. Both of those are indicators of early atherosclerosis. So if you have polycystic ovary syndrome, think about that, think about the fact that you may be at increased risk for early atherosclerosis. Well, why might this be? If you look at the risk factors, or actually not necessarily risk factors, but common associated conditions that women with PCOS have, these include excess weight, high blood pressure, diabetes and insulin resistance, as well as various forms of cholesterol abnormalities. So again, very similar risk factors for heart disease are also kind of coexistent in women who have polycystic ovary syndrome. So when you've been diagnosed with this, think about, hey, what other health conditions are affecting me that might be putting me at risk for this long-term, potentially devastating, disease, cardiovascular disease. Next, this is it's tragic when it occurs, but miscarriages, if they are multiple, can indicate an underlying risk factor that we don't often test for when we're testing anybody for their risk for cardiovascular disease, and that's lipoprotein A. Women with multiple miscarriages have a 5-fold likelihood of having an increased lipoprotein A level. Lipoprotein A is an extra protein that floats around in the bloodstream and attaches itself to LDL, the bad cholesterol, and makes it far more toxic. So anyone, man or woman, with an elevated lipoprotein A level is at increased risk of developing earlier and more aggressive atherosclerosis. And finally, if you look at what all women go through, which is menopause, boy, do our bodies change. From when we lose estrogen, we basically, certainly from a cholesterol perspective, we become men. And our cholesterol profiles really deteriorate. The common things we see is that HDL, good cholesterol, goes down, and LDL, the bad cholesterol, goes up. And sometimes that can be a big surprise because a woman can go through her whole premenopause life with beautiful cholesterol numbers, and then it's almost like overnight her cholesterol profile degenerates. So this can be part of the natural process of going through this hormonal change. But if you have gone through menopause and you haven't had your cholesterol rechecked, go ahead and do that. This is something that you can have an impact on. It's something that can be intervened on. I started a whole company with foods to help people control their cholesterol levels and improve their LDLs. So there's a lot you can do. It doesn't mean you have to go on medications, but it is a risk, and it's something that you can manage and you can reduce as a risk factor for developing heart disease. Okay, so it's hard being a woman, but it's also, something where we can embrace the differences that are unique to us, and we can be proactive in terms of, really acting on any health concerns that we have, any specific things we've gone through during our reproductive years, and really minimize our risk of developing heart disease. Heart disease may be our disease, but it doesn't need to be. Thank you. And if you have questions, comments, please feel free to reach out to us at steponefoods.com.